Hi, my name is William King. I'm a third-year internal medicine resident at the University of Florida and will soon be starting gastroenterology fellowship here at the University of Florida. On behalf of the corresponding author, Dr. Dennis Yang, from the Center of Interventional Endoscopy at Advent Orlando, and the remaining co-authors from the other 11 participating sites, I want to thank gastrointestinal endoscopy for the opportunity to discuss our recent paper entitled Safety and Feasibility of Same-Day Discharge After Endoscopic Submucosal Dissection, a Western multicenter prospective cohort study. Endoscopic submucosal dissection is a well-known, minimally invasive endoscopic resection technique that has become the standard of care in Asia. Nevertheless, ESD is technically demanding, requires substantial skill, and can be associated with serious adverse events. Hence, post-ESD management in Asia has traditionally involved a mandatory multi-day hospitalization following the procedure. ESD has gained traction in the West as an alternative to endoscopic mucosal resection or surgery for selected lesions. With ongoing challenges to our healthcare system and a shift towards cost-effective medicine, there's been an increasing emphasis for same-day discharge following endoscopic procedures. We therefore aimed to evaluate the safety and feasibility of same-day discharge among patients undergoing ESD and to identify factors associated with post-procedural admission. This was a post-hoc analysis of a prospective cohort study that included 831 patients who underwent ESD at 11 participating centers in the United States and Canada. Colorectal ESD accounted for about half of the cases in this study. 29% were in the esophagus and 15% were in the stomach. The median lesion size was 44 millimeters, and median total procedure time was 76 minutes. In all, in-block and R0 resection were achieved in 94% and 85% of patients, respectively. Out of 831 patients in the study, 588, or 71% of them, were successfully discharged home the same day after their procedure. Among this group of patients, only 2.9% were readmitted for a complication. All but one of these were successfully managed either medically or with a repeat endoscopy. Of the 243 patients who were admitted for routine observation, 92% were successfully discharged within the first 24 hours. When looking at factors associated with hospital admission, the following variables were found to be independently associated with a higher likelihood of post-procedural admission: procedure time greater than 75 minutes, intraprocedural adverse events, invasive histopathology, lesion location in the upper GI tract rather than the colorectum, and low volume endoscopist, which we defined as those with less than 50 procedures during the study period. In all, our study demonstrated that same-day discharge after ESD was safe and feasible when performed at tertiary centers. With the shift in healthcare delivery towards value-based care, hospital admission has become an important measure. Our study identified several factors associated with a higher likelihood of hospital admission, which should be taken into account when stratifying patients prior to the procedure. This study provides the framework for additional prospective trials to establish criteria for post-ESD management and to optimize healthcare resource utilization. Once again, thank you for viewing this interview, and I encourage you to read our entire study in gastrointestinal endoscopy.